The National Pensioners Association will from February next year benefit from a mutual health insurance scheme which will complement the National Health Insurance Scheme. The scheme will cater for all types of illnesses including critical cases. 55,000 pensioners across the country, all of them members of the association, will benefit from the scheme. A report by ISABELLA OWUSU.
Old age goes with wisdom and store of knowledge, but it seems aging is becoming problematic in terms of medical and domestic care. By law, at 60, all persons in public service go on retirement. After spending their pension entitlements, they are faced with aging blues, lack of adequate medical care, perhaps with no good home care and companionship. That is where the problem starts. Some are even tagged with witchcraft. According to some of the pensioners, many of them die from lack of proper care or diseases that can be treated. They lack the financial muscle to seek urgent and proper medical attention, which can sometimes prove very costly. These diseases include breast cancer, prostate cancer, hernia, and catharsis. This is why the National Pensioners Association launched the scheme to help its members meet their health needs beyond the National Health Insurance Scheme. They call it Pensioners Medical Scheme, a top-up of the NHIS, which provides the aged with treatment for ailments beyond the NHIS. They think this is more dignifying than placing public appeals on TV or radio for help in emergencies. With this insurance, they are supposed to pay 4 cedis per month for medical treatment in their entire life, irrespective of the illness. This would be deducted at source into a fund. The fund will be managed by Liberty Mutual Health Insurance, has since been started on a pilot basis as registration of the rest of the members is ongoing. 55,000 pensioners across the country, all of them members of the association, will benefit from the scheme. Pensioners who are not members of the association cannot enjoy this top-up scheme. Non-members who want to enjoy this offer must first join the association and pay at least a year's dues of 12 Ghana cedis in addition to a year's premium of 4 cedis per month to qualify.
We have contracted Liberty Mutual Health to help us organize what we call the Pensioners Medical Scheme and then to run it for us. We have realized that many of our people have been having problems accessing medical care. Indeed, when we go to meetings, many of our meetings all over the country, it starts with, we regret to announce the passing away of the following. And if you ask, some of them are dying from simple things like hernia operation, which they couldn't raise money for. People come here asking us for assistance for cataract operations, etc. So we decided that since we are so many, why don't we tax ourselves? Because we discussed this, the politicians, and they have only shown sympathy, and there has been no action coming. So we thought that we should take the initiative, help ourselves, and then as we travel along and we are showing good results, then we may interest other people to pick it up from there.
The National Executive Committee recommended a pilot registration and medical screening exercise in the Western, Eastern, Volta and the 3 regions of the North, namely Northern, Upper East and Upper West. The process for registration of the scheme included authenticating membership of the NPA, the field collection of biographic data of members, medical screening, compilation of the collected data into a provisional register, production of the cards, and distribution of pensioners' medical scheme membership cards. It was followed by medical screening to identify any future disease which could pose a potential burden on the scheme. The screening covered physical examination, jaundice, breast examination, cardiovascular system exam, pulse, blood pressure, heart sounds, respiratory system exam, hearing, abdomen, nervous system, visual acuity, and cholesterol. The medical screening was to attract members to register and to convince those on the fence to join the association. It was also a way of letting them know the benefits that would be accruing to members of the National Pensioners Association when the Pensioners Medical Scheme takes off in 2015. In each region, doctors, laboratory technicians, ophthalmology nurses were recruited to help in the medical screening, which involved urine and blood tests. A number of pensioners with high BP and matured cataracts, which they were previously unaware of, were referred to hospitals in Tamale and Wa. The fourth phase of the pilot registration and medical screening was carried out in the Western region. The turnout in the region was very high. The National Pensioners Association was formed 21 years ago to mobilize NIT pensioners to fight for decent pensions benefits which were regular and fair. The association also carries out programs to improve pensioners' welfare, help in bereavement, and other social predicates. In view of this, the association launched the Pensioners Medical Scheme to help its members meet their health needs without paying any money when they fall sick. Some pensioners expressed their views on the scheme.
This grouping exercise is very, very important to all pensioners. We have so many cases at so many places. When you look at the people, the way they are, at times they come here, they cry for financial help, which we don't have. So it will help a lot.
I think it's a good novelty that they are bringing, and I hope all pensioners will try to appreciate it.
This insurance will be beneficial to the pensioners. This will cover a lot of diseases which do not cover by national health insurance. So in other words, this is for the pensioners. A certain disease like cardiovascular, PSA, and the rest, it can be taken care of.
The Pensioners Medical Scheme was introduced as a result of the increasing number of pensioners struggling to raise funds to meet some basic health situations not covered by the NHIS. The scheme seeks to provide pensioners with quality insurance that can cover them for life. This, they believe, will be convenient to a pensioner who is faced with unexpected medical costs and does not have the money in his pocket. However, every member is supposed to have an NHIS membership card before he or she is registered for the Pensioners Medical Scheme. The ID cards will have pictures of NPA members, the NPA logo, SNIT numbers, house numbers, and other particulars. The National Pensioners Association has been working hand in hand with the National Health Insurance Authority and Liberty Mutual Health to make the dreams of the aged come true. To them, the time is ripe for all to turn attention on the myriads of problems confronting the aged.
It's a registration exercise collating their biodata so that hopefully February 2015 we'll start, we issue them cards and they can start utilizing the scheme. It's going to be for some of the services at the same time where there are some of the services NHIS offers and there are limits, then we increase it for them so that they can get quality healthcare with everything.
The Greater Accra Regional Director of the National Health Insurance Authority, Mr. Lawrence Amate, said the core mandate of the NHIA is to make sure that the health needs of the aged are taken care of.
In life, you definitely grow old and the body will be weak and a number of complications will come and you will need medical attention. For us at the Health Insurance, National Health Insurance Authority, we place a lot more value on the old age. And with these pensioners, we are calling on them, if you are a pensioner or you are above 70 years and you don't have the national health insurance, walk to the nearest health insurance office closer to you and just get registered. It is free. I must congratulate Liberty Mutual Health Insurance for taking the initiative to reach out to the pensioners in the region. They are vulnerable people. They are not as strong as we are. We need to support them.
The pensioners who are registered will get new ID cards in addition to their NHIS cards. The medical scheme is expected to cover both inpatient and outpatient cases. Some of the cases that the scheme would cover include optical, dental, MRI, and CT scan. The rest are X-rays, physiotherapy, checkups, surgical procedures, emergencies, blood transfusion, and hospital accommodation. Though it is for some selected pensioners in the country, it is expected to be extended to all pensioners who are willing to be part of the National Pensioners Association. Perhaps with this initiative, most pensioners and their families will heave a sigh of relief.